I'm conscious also there's a media briefing at 1:30 from Commissioner Costa, and also there is another media briefing from Minister Woods and Air Commodore Digby about the all-of-government oversight of managed quarantine and isolation coming up shortly as well. I'm sorry there's no interpreter here with me. We were unable to arrange one today, but there will be live captioning on the Ministry of Health stream. There are no new cases of COVID-19 to report in New Zealand today. And this is in the context of 6,273 tests completed by our laboratories yesterday. So our total number of tests is now 327,460. As you will well know, this is a high number of tests and much higher than we have been doing over the last few weeks. It reflects a mix of testing in the community, so ongoing testing of anyone with symptoms. It also represents extensive testing of the people who are in the wide net we have cast, who may have had some contact with our 2 cases announced on Tuesday and then the further case announced yesterday, as well as the testing in our managed isolation quarantine facilities as part of that now routine day 3 and day 12 testing. So I think in that context, it is very reassuring that we have no further cases of COVID-19 to report. Another 2 significant clusters from our earlier outbreak also closed today, and those are the ones associated with the Bluff Wedding and the Rosewood Rest Home. So there is one remaining significant cluster that is still classified as open, that is the St Margaret's Hospital and Rest Home in Auckland. Just an update on the managed isolation protocols and a little bit of context here. Just the procedures that are in place at our managed isolation facilities, which have been in place since early April when we moved to require everybody coming across the border to go into that 14 days of quarantine or managed isolation. So that started at 11:59 on April the 9th. When we implemented the regime, and since then, as I mentioned yesterday, more than 19,000 people have been in one of those facilities. The mandatory 14 days of isolation is the key part of our border security, and this is an approach adopted by a number of countries globally, a number who haven't done it, but those that have been successful, like ourselves and Australia and others, have adopted this regime. The routine testing that we started to add in from last week is an additional measure that we put in place. So just reflecting also, since April, anyone who is symptomatic coming across the border or who develops symptoms while they are here and during that 14 days of isolation is then taken to the dedicated quarantine facility where they are tested and their symptoms managed. And since the beginning of April, we've had, I think the latest tally is 37 positive cases at the border, with of course just the 3 of those in the last few days. So we've added in the existing program of the routine testing at day 3 and day 12 for every person, whether they are symptomatic or not. So prior to last week, it was only symptomatic people tested, and so the 14 days of isolation remains the mainstay of our approach at the border. So just to reiterate also, as I've said earlier in the week, no one is leaving managed isolation for any reason without returning a negative test, and there has been some debate about whether this can be required of them. The current order in place requires that someone can only be released if they are deemed to be low risk. As I've also said, someone can be deemed low risk if they have been there 14 days and have returned a negative test. So that's a requirement. If they refuse a test, they can then be held for a period of up to 28 days. So that option is there. From June the 9th to the 16th, a total of 55 people were granted leave from managed isolation on compassionate grounds. The vast majority have been tested and returned a negative result, as you've seen with no further cases, or have returned to the facility where they will be tested. Now, a number of those arrangements were what you might call a short leave pass from the facility, so going out for a period of 1 or 2 hours, either to visit a dying relative or loved one, or to attend an event of some kind, obviously prior to the ban on people attending funerals or tangihanga. So we're working our way through the remaining ones as quickly as possible. It's important to emphasise that anyone who departs a facility on compassionate grounds does so under a very strict set of criteria about what is required of them in terms of physical distancing, wearing of PPE as appropriate, to ensure there is no risk of infecting someone else if they are in fact unwell. As you also know, on June the 16th, actually exemptions from managed isolation on compassionate grounds have been suspended. Yesterday, across our managed isolation facilities, 1,061 tests were completed through 5 mobile units that the District Health Boards provided. There are a further nearly 700 tests scheduled today, also being provided with the mobile units, and testing will continue in those facilities over the weekend. It is a mix of mostly the day 3 and day 12 testing, but also some follow-up of anyone who may have come in contact with the gent who we announced as a case yesterday, that is those who were on the flight or those who are in managed isolation, and I think 3 people who had been granted compassionate exemptions, of whom 2 are actually in managed isolation. They were just day or short period passes. Just the 2 cases on the 16th of June, as we've gone through the contact tracing, and again taking this approach of casting the net very wide, we now are following up a possible number of people, just over 401 people. None of these people being followed up through this process are considered close contacts. You will recall the only close contact is in fact the father of the 2 women with whom they are here in the Wellington region. So far we have 174 who have returned negative results, and the other results are pending, so there's been a lot of testing gone on. Some are still pending the results. The breakdown of testing is that 4 aircrew, 97 hotel and health staff in the facility, 71 former hotel guests, and 2 exempted individuals, that is, of those who have returned negative tests. And in addition, there were, I think, over 250 current guests in the Novotel who were all swabbed Tuesday, Wednesday, and all their results, of course, are negative. So, just to finally, we are undertaking a significant, what I would call very precautionary testing. Under previous circumstances, we wouldn't have tested any of these people, but we are, of course, in a position where we are wanting to, as I've often used the language, put a wide ring fence around any possible ongoing transmission, and I think the results of the testing to date are very, very reassuring. I'm happy to take questions.
I'll
go here first, please.
On that transfer flight from Auckland to Christchurch that we discussed yesterday, there were 4 Air New Zealand crew on that flight. The plane was obviously full of people who could have COVID-19. Why don't they have to isolate?
Well, we don't isolate people generally at all on domestic flights, and of course, A, it's a short flight, and B, they are required, everyone on the flight is required to use appropriate PPE to help reduce any risk of infection, including the aircrew.
But isn't there a good chance that they could have called something off one of these people, given what we know of at least one man
I'm happy to
who was a
take
contact of the
I'll go here first. Well, the risk
on
will be
that
very low. So we will make sure that, including we'll make sure that we are leaving no stone unturned. As I've said, we're now up to 401 people, so we are ensuring that. I'm happy to take questions.
Has the Ministry of these two women leaving their isolation in Hutt Valley to visit friends or the bank?
No.
Those 55 that were released on compassionate grounds, you say the vast majority were tested and came back negative. How many were tested, and does that mean that not everyone was tested before being let out?
Correct. So not everyone had been tested, and largely because they were going on day leave with very specific precautions, and they're now back in the facilities and will be tested as part of the day 3 and day 12 testing. Now, of course, what's in place is that, well, of course, no one can leave on compassionate grounds, but no one leaves a facility unless they have returned a negative test. The balance, we are being followed up and being tested.
So how many were tested?
I don't have the exact number. I do know that the majority who had already been or who have been tested, the results are negative, and we're doing the balance, and I'll update you as we get further results through.
Those 6,200 tests, is that a record number of tests in a day?
It's not a record. I think there were several days in alert level 3 when we were doing quite wide surveillance testing where we got up over 7,000, but it's by far the biggest number for some time, and it does include the testing in the facility and the follow-up of any possible contacts.
So you're able to ramp it up pretty quickly?
Yes, we can still do over 12,000 tests if needs be per day, which is a very good capacity, and that's a fundamental part of our ability when we get in this situation to be able to ramp up the testing quickly.
Why have people been able to get the right to refuse a COVID-19 testing given the risk to public health?
So just to go back to the comments I made earlier, that since April and until last week, the mainstay and what continues to be the mainstay of our border measures is the 14 days isolation period, and it's very important that that remains in place, and of course that it's done well. We've added in the testing, and that was just an extra belt and braces measure. There was some uncertainty about whether the current order, which was issued for that April 9 when we started this, did allow for people to be required to take a test. I have clarified that, and yes, they are required to not just take but return a negative test before they can leave the facility.
If you're forced to stay in isolation and if you refuse the test, why are people in quarantine still being told it's not compulsory and they can still refuse it?
Well, they can refuse it. However, if they want to leave the facility at day 14, they will have had to have returned a negative test. Otherwise, they may need to stay in there for another 14 days.
Should that not be made clearer on the paperwork though? Because we've seen paperwork given out to people today saying you can decide whether you have a test or not.
So let me be clear, a test is a medical procedure. It's slightly invasive. In fact, the test, the swab at the back of the nasopharynx is designed to actually get cells off the back of the nasopharynx, the back of the nose, because the virus is inside the cells and you need that to be able to do a proper test. As such, it requires informed consent. And so what we're telling people is you are not being compelled to do this. However, it's also very clear to everybody now that a negative test is required if they want to leave the facility, and certainly at the end of that 14-day period. Otherwise, we may require them to stay for an additional 14 days.
So what legal powers do you have to actually enforce this?
Yeah. So the order that under which the testing is happening now, and indeed the holding of people for 14 days in that isolation do this, is however, it's also very clear that it's issued in my name as a National Medical Officer of Health.
We've been told.
Have you now tested everybody that's in managed isolation for those 3 days? Have you effectively caught up and now everyone is in line with the proper testing regime?
If not yet, it will be by the end of today. So there's the nearly 700 tests being done today, and I've asked that we've got good testing capacity over the weekend as well, so that we can. What I also don't want is for people to be delayed if at the end of their 14-day period. So I want to make sure that we have got capacity to test everyone at the 12 days, and also to have gone back and caught up with everyone at the 3 days.
And can I also ask just about morale at the health department? I mean, the Prime Minister publicly said that she had lost confidence in the department. She also said that the whole of New Zealand had been let down by you.
I don't think she said she had lost confidence in the department. I think she had lost confidence.
She very firmly said she'd lost confidence
in the department. Well, what I can say is, and I've spoken with the Prime Minister, and of course I've offered not just my apologies about what happened, but my reassurance that we would sort it out. And I've taken responsibility for the fact that not everything was in place. As the Prime Minister has also said, it was a system issue. And I've taken responsibility for sorting that out, and I think the progress we've made in the last few days shows that I'm taking that seriously.
But is it affecting workers on the ground? Is it affecting bureaucrats? Is it affecting people?
Oh, look, they're all fantastic people who get up and go to work every day too, and they're particularly motivated by keeping New Zealanders safe. I'm working hard with my team to make sure people remain positive and motivated, and I do know, and I've had a lot of feedback over the last 24 hours about how proud people are of what we have achieved and how determined they are to keep achieving that and keeping New Zealanders safe.
It seems very clear here that the issue here is poor communication and management by you and the ministry, as even staff in the quarantine sites are still confused. Would you feel the same?
Oh, I don't think staff on quarantine sites are confused, nor anyone in quarantine, nor I would say is any New Zealander. I've been really explicit since Tuesday. No one leaves the facility unless they return a negative swab. Of course, they can decline having a swab, but making it really clear, people may need to stay for an extra 14 days. So I don't think there's any confusion there.
When were concerns raised with you of the legality of mandatory testing?
It became apparent that when this situation arose, and as I asked, dug deeper into it, that there was some question about whether or not people could be compelled to have the test. As soon as I found that, or not, whether they could be compelled, because we're not compelling them, that they could refuse a test, I rang our Chief Legal Advisor and got it very clear and said, I want to be really clear that people, that I can require people to have returned a negative test result before they leave managed isolation. That was on Tuesday. As soon as I had his advice, I then asked that all facilities be told, and that was confirmed to underpin our testing at day 3 and day 12.
And so, can the ministry put a number to the amount of people that have left this isolation without being tested?
I am still working on that. I can say, and I was asked this yesterday, so sorry that I haven't got that number. We have focused first on ensuring that we are casting the net wide around the 3 cases we've got, then on following up everybody who was let go out on a compassionate exemption, to follow them up if they hadn't had a test. And then we will go back, and we are going back and looking at what the number is. However, what I would say is that all those other people who left will have completed their 14 days of mandatory isolation, and on the way out they undergo a health check, and that is what has been in place since the 9th of April, and it has served us well.
How many
Those
people in
have to
quarantine are
be
you?
tested, the ones who were let go?
No, they won't need to be tested. They've completed their 14 days of mandatory isolation, and we are following up. Remember though, we are following up everybody who may be a possible contact of the 3 cases that we have had in managed isolation, if they have left managed isolation, or who were on the flight.
How many people in quarantine are you
Why
still
people
treating?
who were on the flight from the UK to Doha are being treated as contacts from the positive cases who came from the UK?
They may well be, because we have let our Australian and Qatar counterparts know, and UK counterparts know about the cases here, so that they can do appropriate contact tracing for people who may have stopped their journey either in Doha or in Brisbane. So they will follow up those people.
Okay.
But we're following up all those who came on to New Zealand, whatever flight they were on.
How many
There's a
people?
Kiwi woman who was on that flight who said she could have been sitting right next to this woman. She doesn't know, and she's been in isolation for 10 days and hasn't been called to say that she's a contact.
That would surprise me, because if she's in managed isolation, we were quickly able to get the manifest. Do you mean on the flight from Doha?
From London to Doha.
Right, okay. Well, I'll follow that up. I'm very surprised to hear that. But of course, if she's in a managed isolation facility, she will be being tested as part of our regime there.
How many people in quarantine are still yet to be tested?
In quarantine, that's our Jet Park facility, everybody is tested because they're symptomatic. In managed isolation, we are, again, 700 more people are being tested today, and we're just making sure that everyone is having their day 3 and day 12 tests, and certainly the day 12s, so that there's no delay in their departure at day 14.
Is it possible some people will need to stay past their 14 days in isolation due to resourcing issues?
We're working really hard to make sure that isn't the case, and I asked this morning if we could put extra testing capacity on so that people's departure was not held up. I think that's very important, and I'm very hopeful that there isn't a delay for anybody.
Has there been a delay so far?
Not that I know of.
In terms of the...
Because we started by prioritising those people who were due to be released and testing them first. Question here, and then there's one more there.
I was really about to ask
Okay.
that question.
Please.
In terms of the process for managing these facilities, could you just provide us with a breakdown of who the people are who are at the facilities? No doubt it's an all-of-government effort, but what portion are Ministry of Health nurses, Ministry of Health admin staff, or private security staff that have been procured? We just want to know who are the people?
So I think that question's best directed at Air Commodore Webb, who's going to be with Minister Woods shortly. Thank you very much. Shortly. But what I can say is that we're responsible for ensuring that the health staff are there to do the health parts of that whole operation, and that includes nursing and other support staff to do the daily health checks and to come up with the lists of people who need to be tested, and then the District Health Board teams come in and do that actual testing. But Air Commodore Webb will be able to provide the overall numbers. I have to say that at one point there were over 500 staff across all the different facilities, and it is still several hundred from a whole range of different places.
Before someone leaves, does a Ministry of Health staff member need to okay it, or can another official okay it based on the information that the Ministry of Health staff member has no doubt put into the system?
Yes, and so they're not Ministry of Health staff members per se in the facilities, they're part of the overall team looking after. Actually, I think we do have one person in each facility, but there's quite a process for departure, and that includes the health check that has to be completed. It obviously now includes the requirement for the negative test, and there's a sort of sign-out process that people go through. But fundamental to that is that they have had that health check by the nurse, and now added in the negative test.
We've been told
last couple of questions.
Resuming flights to Shanghai. Is
Mm.
this going to place additional pressure on the border, and is the border testing up to scratch?
The number of people coming into the country and the number that need to be managed across all of the facilities are quite full, so we're constantly having to think about how we can increase capacity. Testing capacity we can scale up as required. We will make sure that everyone gets that testing at day 3 and day 12 as part of the 14-day managed isolation, so I've no concerns there.
And just in terms of the use of downtown hotels, especially in places like Auckland, but in areas that are quite populated, is that a safe approach given the possibility of bumping into people on the street, for example?
Look, I think there are really good and clear protocols in place to ensure that we are keeping the rest of New Zealand safe, and that we're stopping any risk of others being infected, and those protocols have served us well. Air Commodore Webb will talk about the other measures that are being put in place to help ensure that that the processes and procedures are absolutely airtight.
Are mobile testing units overstretched?
No, we can, the DHBs can add in extra staff, including District Health Board staff as required, so that we can make sure that all the testing that needs to be done can be done.
So there's been no delays in testing those in quarantine?
I can't speak to any delays. What I would say is that, of course, when one visits a GP or many other health practitioners, sometimes there's a small wait because, and so I would expect that maybe people might have to wait a short period of time, or if there are more people to test at one facility before the team goes to another, there may be a short wait. But remembering that the testing is happening at day 3 and day 12, so the day 12 testing is well before people need to have everything ready for their departure on day 14.
On capacity, is there, I know you had plans to open facilities in Christchurch and Wellington. Has that happened, and will you open them in other places as well?
There is a facility open in Christchurch. It's been open since last week. Wellington, I think I just have to check that, I'm sorry. And there is work afoot to see if a facility needs to be stood up in Rotorua as well, and that work's going ahead apace.
What changes are there going to be for you in your role now that the Air Commodore has kind of taken over?
Nothing in particular. I'm going to keep working very closely with Air Commodore Webb. I had already been working closely with him for some weeks, and Mike Bush and the all of government team, but it's just a reminder that this is really a big cross-government effort, and I'm going to keep ensuring that the leadership of the health component of that is not just extremely robust in and of itself, but is well linked into the rest of the effort.
And just quickly, have you got any more information about the homeless man who supposedly snuck into an isolation facility?
Nothing more than what I have seen in the media, but again, that wasn't so much a health issue as a management of the facility issue. That sounded very opportunistic, but I don't know quite what currency one can put on that report. Look, thank you very much. Have a good weekend.
Thank you.
Thank you.